So the typical injury that I would perform marrow stimulation surgery would be a patient who injures their ankle, maybe with an ankle sprain or some other type of injury, and it injures the cartilage and creates a defect in the cartilage as well at the same time.
So I've been in practice almost 20 years, and I would say for the first 15 to 16 years, we would use literally a handheld pick and a mallet. It's hard to control the depth that you go and also the width of the hole you make.
Conventional treatments of microfracture performance are terribly unreliable. I think they cause a lot of damage, which I think is directly correlated to more pain, more stiffness, and overall poor functional outcome for patients.
We don't get the stimulation that we're looking for, and so we don't get coverage of the lesion, and it leads to some issues, which is frustrating for the patient and for the doctor.
He leaves the surgeon feeling pretty hopeless, leaving the operating room thinking that I did everything I could, but I didn't get the result I was looking for.
The SmartShot needle penetrates over 6 millimeters deep into the talus, which has been shown in studies to create the best marrow, and it is much better than previous legacy devices, which really only go 3 or 4 millimeters deep.
We're not doing as much disruption to the subchondral bone, and we don't have as much damage, if you will, in the ankle because the environment tends to be better controlled.
The unique design of the SmartShot ankle device allows access to more posterior osteochondral defects and lesions, with also getting perpendicular to the bone and getting into the deep aspect of the marrow within the talus.
What the science tells us is that the SmartShot device equates to less bone compaction and more consistent bone healing and remodeling.
The more I've used the device, the more I've seen a clear-cut difference in the overall recovery of patients.
Getting their motion back is critical. They're happier, helps the lesion heal better, it helps shape the lesion like we want it.
Less pain initially, they're less stiff, and we can accelerate their functional rehab.
It is important to know that you can do that safely for your patients and get them pointed in the right direction, and that they're going to do well in the end.
It's a win-win. It's great for the surgeon because it's easier to use, and it's great for the patient because it's getting the marrow access we're looking for.
I really think SmartShot device will revolutionize how we perform marrow stimulation.
I would recommend SmartShot to a colleague for the simple reason that it works.
SmartShot ankle is an answer to a difficult problem. It's easy to use, it's a great product, it works, your patients will be happy.